Hello, I'm Dr. Louis Hassel. I'm a professor of pathology at the University of Oklahoma Health Sciences Center in Oklahoma City, Oklahoma. And this is part of a short series of videos on certain preventive and healthy practices gleaned from my experiences as a pathologist and as a individual. So as you may know, pathology is the study of disease and essentially what goes wrong in the human body, whether that's cancer, whether that's diabetes, whether it's other infectious disorders. A pathologist is oftentimes the one who makes the diagnosis, either by looking at tissue or by performing laboratory tests, or occasionally even by doing a examination after death, what we call an autopsy or post-mortem examination. So I'd like to share with you one experience that taught me a great deal. It was very poignant, and it was based on the study of a young, fairly newborn child, about a month old, who had come to the hospital sort of lethargic, not doing well, a little bit febrile, and had fairly quickly passed away. Somewhat puzzled by why this course of events would ensue, the parents, who were older parents, well into their 30s, and probably somewhat pained at the loss of this child. They had both married late, and this was their first child. And so to lose a very precious child at that stage of life when the prospects for having more were probably next to none, must have been very, very painful for them. So with all of that emotional setting on my autopsy examination, I proceeded to examine the child both externally and examine each of the internal organs. What I discovered was that the liver was quite swollen and abnormal, as well as the adrenal glands. And later, we also discovered that there were lesions in the brain as well. When we looked at these under the microscope, what we discerned were characteristic signs of a particular viral infection. The herpes virus had infected this newborn child's adrenals, muting or eliminating its ability to respond to stress, had infected its liver, damaging its ability to mobilize nutrients for proper growth and development, and obviously its brain, where many functions of the normal brain were damaged by this infectious process. So I asked myself, how does a 1-month-old child develop disseminated herpes virus infection throughout his whole body? And the answer is, of course, that there's a significant exposure, possible exposure, to herpes or other viruses when that child passes through the birth canal. Within the womb, within the amniotic sac, they're safe and protected. But once they pass through that birth canal, there's a particular exposure that can occur then. So then you say, well, was in fact the mother infected? And in fact, she was. The story was perhaps not unusual. As a young teenager, she had become sexually active, been exposed to a variety of different partners over her life, and from one of these partners had contracted herpes infection. Now, ordinarily, if an obstetrician knew that the herpes was present, and particularly if they knew that this was an active infection, they might have chosen to deliver the child by cesarean section. But she was experiencing no symptoms. Sometimes in contrast to when we have it on a cold sore or an external location where there's lots of nerve endings, we may feel pain. But with some internal sites of infection, there can be no associated pain. And so the child passed through the birth canal and went through a month of life ending in a very tragic loss for both the child and the parents. Well, from that experience, I deduced a couple of things. One is that what we do when we're teenagers and in our 20s matters. Who we associate, whether or not we choose to have intercourse, whether or not we choose to have sexual relations with a person without a commitment, without a determination that that's true, that matters, not just to us, but possibly to our children and our grandchildren. And so, to me, this was a very strong lesson for fidelity and for monogamy. Choose wisely your partners, choose wisely where you're going to share your most sacred experiences, and then be faithful and true to those throughout your life. And that's a recipe that has served me very well. Unfortunately, that was not the choice that these parents had followed, and they suffered a very painful, a very sad, and very tragic outcome. So my advice to you, my young friends, is to choose wisely. Make choices as a young person, not just with what feels good now, or what may seem to be right, or what you feel pressure to do, but with a long-term view that good choices now, restraint now, fidelity now will have a positive long-term effect, and rather than a potentially very dire and painful one. So with that short message, I share with you my encouragement to be strong, to be wise, and to make good choices in terms of your sexuality and your interactions with peers and friends and others. So until next time, thanks for joining me.